Hi, my name is Jake Franchi, and today I'll be discussing Duchenne muscular dystrophy. Duchenne muscular dystrophy got its name from the French neurologist who actually discovered it, Guillaume Benjamin Amand Duchenne, and he discovered it in 1860. So there are a number of symptoms for DMD, the primary one being weakness in musculature. This is because this is a disease that affects the muscular system. So what usually occurs in children that do get diagnosed with DMD is that their lower extremities are affected far more compared to their upper extremities. And what typically happens is that the proximal muscles of the legs, so your quads and your hamstring muscles are affected first, and then the distal muscles of the leg are affected second. The other symptom, difficulty with walking and maintaining balance. What usually happens is children exhibit gait abnormalities, so the way that they walk is not normal, and this is due primarily to the fact that contractures, which is the tightening of muscles, they occur, and that prevents them from walking normally. And this leads into our third symptom, which is the enlargement of calf muscles. And as you can see by this image, this patient's calf muscles are larger than they should be. And this is due to the buildup of fibrous tissue in place of muscle within the legs. So the calf muscles actually take on this firm appearance. And then a final symptom is delayed intellect and speech. According to one source, 50 to 70% of children with DMD have delays in speech and intelligence. So this is something that we also have to consider when looking at this disease. So there are a variety of ways that DMD can be diagnosed. Typically, what would happen is a physical examination would occur first, where a physician will do a physical screening of a patient. And they may come across and discover things such as pseudohypertrophy, which is that false enlargement, the swelling of muscles with fibrous tissue, as we saw with those calf muscles in that photo in the previous slide. They may also show lumbar spine deviation, gait abnormalities, as we discussed, and several grades of diminished muscle reflexes. And on top of the physical screening, a doctor may also consider the patient's medical history as well as the patient's family's medical history. Another way that DMD is diagnosed is through enzyme testing. Doctors can actually look at a specific enzyme in the blood called creatine kinase. And what is typical with patients that have DMD is there's a high amount of CK enzyme in the bloodstream, and this is primarily due to the fact that when muscles become damaged, high levels of creatine kinase are released into the blood. The third way is through a muscle biopsy. This is more of an archaic way of testing and diagnosing for DMD because genetic testing has kind of taken the forefront. But with muscle biopsy, what happens is a piece of muscle is actually extracted from a patient, and then the muscle is analyzed to determine what is going on inside of it. But as I said, with genetic testing taking the forefront, this way of diagnosing isn't really used as much anymore. And that leads to genetic testing, which is used to analyze the DNA of cells of patients to see if there is a mutation of the DMD gene, which is the dystrophin gene. So we'll be discussing that actually in the next slide when considering the genetic basis of this disease. So Duchenne muscular dystrophy is strictly a genetic disease, meaning that if you have a family history of this form of muscular dystrophy, then you are susceptible to getting it yourself, or you're susceptible to passing it on to your children. So family history is a significant risk factor when looking at DMD. The actual disease can be passed on through X-linked recessive inheritance, meaning that the mutation of the gene for DMD, which is the dystrophin gene, is carried on the X chromosome. And that kind of leads into the other risk factor, which is the sex of the offspring. So males are more likely to be affected than females by Duchenne muscular dystrophy. And this is primarily due to the fact that females inherit two X chromosomes, so therefore they inherit two dystrophin genes. So if one of those genes is affected and is mutated, the other healthy dystrophin gene can cancel out such mutation from manifesting itself. This makes the female a carrier, though, so they do have the possibility of passing it on, but they aren't themselves affected by it. Males, on the other hand, only carry one X chromosome. So if they inherit a mutated dystrophin gene, then the mutation itself will become apparent and they will be affected. Female carriers of this X-linked disorder have a 25% chance with each pregnancy to have a carrier daughter like themselves, a 25% chance to have a non-carrier daughter, 25% chance to have a son affected with the disease, and a 25% chance to have an unaffected son. And this is visualized by the diagram, the illustration here on the PowerPoint. So now we're going to discuss the normal physiology of the organ system affected by Duchenne muscular dystrophy. And as I had mentioned earlier in the presentation, the body system affected is the muscular system. And when we take a step back and think about the primary function of the muscular system, it's to enable body movement. Throughout our day, we're doing a number of different tasks like walking or getting up out of a chair, and we don't consciously think about it, but there are a different number of muscles that are being used and recruited to enable these movements to occur. And when we look at muscle itself, at the very cellular component of muscles are muscle fibers. So these are the smallest basic unit of muscle. And on the membrane of muscle fibers, there are interdependent proteins, so proteins that rely on one another. And what they do is they assist in keeping the muscle cells operating properly. And one of these proteins is called dystrophin. The name probably sounds familiar because I mentioned it a few times already. And dystrophin's main function is to help strengthen muscle fibers and also protect them from injury as they go through the phases of contraction and relaxation. So when we're using muscle and when we're not using muscle, dystrophin is really being used to protect the muscle fibers and strengthen them during these processes while they occur. So now let us consider the pathophysiology of the muscular system and its disease state. And when we consider individuals that have Duchenne muscular dystrophy, we're really talking about a mutation of the DMD gene occurring within these individuals. The DMD gene is responsible for the production of the dystrophin protein. So individuals who are healthy and don't have a mutated DMD gene, they're going to produce functional dystrophin protein. And as we have discussed earlier, functional dystrophin protein, its role is to act as a stabilizing agent for muscle fibers as they encounter the forces during muscular contraction and muscular relaxation. But when this gene becomes mutated, as is the case with individuals who do have Duchenne muscular dystrophy, the gene becomes incapable of producing any functional dystrophin protein. So this causes a problem because without any functional dystrophin protein present to protect those muscle fibers from the forces they encounter during those different muscle phases, the overall integrity of the musculature begins to lessen as the muscle cells themselves become more and more damaged from those forces during the phases of muscular contraction and relaxation. And this leads to the formation of fibrous tissue within the muscles. And that kind of relates back to the images of those enlarged calves. We see those contractures occur because that fibrous tissue builds up in place of the muscle. When we look at the treatment options for Duchenne muscular dystrophy, there are currently no available treatment methods that inhibit the progression of this disease. So if you are diagnosed with this form of muscular dystrophy, then there are no steps that can be really implemented to prevent its advancement into its different stages. When we consider treatment methods, we're really looking at what therapeutic interventions will improve the overall quality of life of individuals that do have DMD. So one of these is physical therapy, and through stretching, non-strenuous exercise, and the use of braces, patients can maintain some level of flexibility of those muscles. And this is all in mind of trying to prevent contractures from occurring. And those contractures, as we've discussed, is that hardening and stiffening and shortening of the muscles. The disadvantage of PT is that it's inevitable that contractures will occur. So it's as much as the stretching and different forms of PT are helpful, it's inevitable that the contractures will eventually occur and become apparent. The next is scoliosis surgery. This comes into consideration when individuals that do have DMD have profound scoliosis of the spine. So that's that deviation of the spine. This procedure includes the fusion of vertebrae and the insertion of a steel rod to promote more of an upright posture. The disadvantage with it, though, is that if the incorrect form of anesthesia is given during surgery, there are implications on the cardiovascular and respiratory health of the individual. And this is primarily due to the fact that individuals with DMD have cardiovascular and respiratory problems as is. So that needs to be considered when considering surgery. The next is cardiovascular care. Through angiotensin converting enzyme inhibitors, ACE inhibitors, angiotensin receptor blockers, and beta blockers, deterioration of cardiac muscle can be stopped or prevented for a little while. So what these different forms of treatment do is it makes it easier for your heart to pump blood. It basically allows for the relaxation in the veins and arteries, so the blood pressure is reduced, so your heart is not as strained to do work to move blood throughout the body. The disadvantage for this form of treatment is that it's super expensive, and as with all the other options, it only slows down the progression of this disease. And the last form of treatment is respiratory therapy. In individuals that do have DMD, there are a number of complications that can arise, respiratory complications, ineffective cough, lower respiratory tract infections, and obstructive sleep apnea, and also respiratory failure. So certain forms of therapy are implemented, such as lung volume recruitment, assisted coughing, and assisted ventilation, all in mind of trying to improve the overall ventilation and lung health. The advantage is that it will improve quality of life, but as we have noted with most of these treatment options, it only slows the disease, and specifically for this case, it requires a ton of monitoring. It's not something that you can just do from your house or do without a physician present.